Hi everyone. So I did my informative speech topic on the effects of the weather on the human body, especially in the winter, and I thought that that would be really relevant to us living in New England, seeing as how we suffer from such terrible freezing cold winters. And one disorder that I came across that's called seasonal affective disorder is what I wanted to focus my speech on. And what that is it's a recognized mental disorder. It's classified as repetitive episodes of depression that usually begin around October, November, and they last until May, and then they resolve in the summertime. So it is diagnosed by qualified clinicians through a physical examination, an interview, and something called a seasonal pattern assessment questionnaire. Um, Evidence has found that SAD is caused by a lack of exposure to sunlight and a change in sleeping pattern. So those who are most affected by SAD usually live in northern latitudes, such as us, and it's actually been found that women are twice as likely to suffer from this disorder than men are. So some of the symptoms of SAD are very similar to those of clinical depression, and they can include fatigue, change in sleeping pattern, and decreased energy level. Some that are specific to seasonal affective disorder include an increase in weight gain, difficulty staying awake, and incapacitating fatigue, and also a severe craving for carbohydrates and starchy foods, which probably leads to the weight gain. So also patients will see a severe low mood in the wintertime, and it's often improved in the summer. And sometimes it can be accompanied by what's called hypomania in the springtime. Um, so patients usually see seasonal affective disorder as either like a mild, moderate, or severe cases. And in some severe cases, one study actually found that these patients suffered such impairments in their quality of life that they were equivalent or greater than some people suffering from other psychiatric conditions. So it is a pretty serious mental disorder. And some of the impairments that they suffered was seen in physical functioning, pain, social functioning, and also mental health. So right now there are three main therapies used to treat seasonal affective disorder, and they include light therapy, antidepressant therapy, and cognitive behavioral therapy. So first is the light therapy, and that's used for mild cases of seasonal affective disorder. And what that is it's daily exposure to a bright light, and it's done for about 20 to 60 minutes a day. And it does have some side effects that include sore eyes and headache. And the next therapy that is used is antidepressant therapy. And one antidepressant that is actually approved solely for the treatment of seasonal affective disorder is called Wellbutrin. And it's actually given sometimes prophylactically to help prevent the symptoms from occurring from people that know that they have suffered from this in the past. And it's actually seen to be most effective when it's used in combination with either cognitive behavioral therapy, light therapy, or both. And it's generally used for severe cases of seasonal affective disorder. And then cognitive behavioral therapy is used for mild to moderate cases, and it's for patients to try and manage their symptoms and talk about them and gain control over those symptoms. And then some other things you can do if you feel like, winter or this weather has got you kind of depressed is they have over-the-counter supplements called melatonin and vitamin D, which can help regulate your sleep cycle and have been proven to help with that. So in conclusion, from what I've read, seasonal affective disorder is definitely not just a case of the winter blues. It's a real mental disorder, and like other mental disorders, it can be treated and managed if diagnosed early enough. So thanks for listening, and good luck with the rest of the winter. I hope we get no more snow. Thanks.